Welcome. It is so great to see all of you. I am Lorena Marshall Blake, the president of the Independence Blue Cross Foundation and vice president of Community Affairs for Independence Blue Cross. I can't begin to tell you how honored I am to be here at Temple University on this beautiful campus with all of you today. The Charles Library is a fitting setting for our announcement. It is innovative and sustainable and gives each student space to learn, to grow, and yes, to thrive. And that is why we're here today, to help students thrive. When world-class organizations come together, we can achieve not just good things, but I changed this, great things. I'm so excited, again, about our collaboration with Temple and the initiative we are announcing today. On behalf of the Independence Blue Cross Foundation, I want to thank all of you, our esteemed guests, our legislators, our partners for joining us today. And I want to acknowledge Dr. Jason Wingard, the Temple University's newest president, and I got to meet him today, so I'm real excited. All right, and he's taller than me, but most people are, that's okay. And our Executive Vice President of Public Affairs, Steve Farah, who will share remarks with us this morning. But first, I'm delighted, I'm privileged, and I'm honored to welcome the President and CEO of Independence Health Group, Greg Devens. He is committed, yeah, you can clap, it's okay, it's all right. He is committed to achieving equitable whole person health for all, and I believe this initiative builds on that commitment. Please join me again in welcoming Greg. Thanks, Greg. And I also want to mention, as each speaker comes up, Brianna will just, wipe the mic, so everybody's okay, just trying to be healthy, okay? Great, thanks. Okay, thanks again.
Well, thank you, Lorena, for those kind remarks, and thank you, Brianna, for keeping us safe. I want to just say good morning to everyone. It's a great, great privilege to be here with you today. President Wingard, I want to thank you for having us here at this beautiful campus, and I was commenting to my colleague Steve as we drove up in front of this library. I said, this doesn't look like the library that I remember when I was in school. So, every time I've come to this campus, it makes me want to go back to school. So maybe there's chance for me at some point. But I want to congratulate you on your appointment as president. And like you, I'm in my first year as a chief executive officer, and I'm looking forward. Thank you. Thank you. We had a chance to meet over the summer, briefly, in passing, but I'm looking forward to working with you for many, many years to come. But I'm excited, really, to join you this morning for the launch of the Independence Blue Cross Foundation Healthcare Scholars Pipeline Program. We're extremely, extremely proud to support Temple in providing full nursing scholarships to a cohort of students of color from local high schools. This is one way that we are taking aim at racial and economic disparities that need to be reduced or eliminated so that the American healthcare system can reach its full potential. If we have a diverse healthcare workforce that recognizes the humanity of all patients they serve and delivers culturally competent care, we will be a step closer to creating true health equity. So we have to make sure that economic hardship does not stand in the way of any young person who wants to pursue a career in nursing. I want to thank my colleague, Steve Farah, and of course, Dr. Lorena Marshall Blake of the Independence Foundation and their team. They do an incredible job for us day in, day out. I also want to thank the public health and nursing leaders here at Temple for your work and efforts. And I really do think that this program exemplifies what we can accomplish together with vision and collaboration. Today marks another milestone in our company's 20-year journey of supporting the nursing profession. In total, we've invested over that period more than $26 million in nursing education and other programs in support of nurses. That's in addition to more than $28 million that the Independence Blue Cross Foundation has provided to community health centers that increase access to care in medically underserved communities, as well as a number of partnerships addressing health equity and the social determinants of health in those areas as well. And we take all of these efforts together, it really represents the fulfillment of what Lorena spoke about, our company's commitment to what we call equitable whole person health. So in that spirit, we're excited to work with Temple on nurturing the next generation of nurses right here in Greater Philadelphia. So thank you very much, all of you, for being here. Thank you, President Wingard and your entire team for all of the great work you're doing, and congratulations to the future nurses who are represented here. So thank you.
Reverend Dr. Marshall Blake, thank you very much. Yes, I have to embarrass you. Thank you very much for the introduction. I really appreciate it. And Mr. Devins, we have a stool for you in several of our classes, so we're going to get you here back on campus. We can have you here in the Charles Library to be able to meet our students. So I'm just so honored and privileged to be here today. Elected officials, thank you all also for being here. We appreciate the support truly. The celebration of this program, the Independence Blue Cross Foundation Healthcare Scholars Pipeline Program. This is a phenomenal time for us to be celebrating this. Scholars, can you please stand up for us? Now, continue to stand, please. I know the microphone can't hear you, but can you please state your names and your Temple students now, so loudly, clearly, and the high school that you graduated from, okay? Let's start on the left, right here.
Hi, everybody. My name is Justine Jones, and I'm a Crystal Ray in Philadelphia High School graduate.
Justine Jones, Crystal Ray, all right.
Hi, everybody. My name is Sakisha Samili, and I'm proudly a Crystal Ray in Philadelphia High School.
All right, Sakisha, nice to see you. All right, Hannah.
Hi, everyone. I'm Jamera Briggs, and I graduated from
Very good, very good. All right, thank you. All right, you can be seated. Thank you very much. It's important for us to recognize and see the faces of why we are here to celebrate. This is a unique opportunity for us at Temple University. We have a strategic vision of excellence that encompasses 3 parts. And this particular program, this partnership that we have with Independence Blue Cross Foundation exemplifies that. The first is academic excellence. It is important for us as Temple University to make sure that the students that we are training and preparing are able to meet the demands of the workforce, that they can get jobs, that they can be prepared to do those jobs well and stay gainfully employed for their careers. And so this type of program will reach into the community and we establish a pipeline of students who otherwise wouldn't have this kind of opportunity, and then we bring them into Temple University to get degrees and training through an innovative curriculum in nursing. This is phenomenal, and so we are so proud. Thank you, yes. It's just important for me to underscore that this kind of partnership where public sector and private sector come together, Temple University and Independence Blue Cross through the foundation are able to do this kind of work, because if you don't have these kinds of partnerships, it doesn't happen. And if it doesn't happen, then the pipeline isn't formulated. If the pipeline isn't formulated, then we don't have the care in the field, in the types of communities that we serve here in North Philadelphia. We don't have the people who care about that kind of healthcare. And so this is really important for us. So academic excellence is important. Community excellence. It's something that Temple University is founded upon. It's part of our mission. We are here in North Philadelphia. We are proud to be here in North Philadelphia. We are proud to serve the residents through our healthcare system and through our academic enterprise. And so we want to make sure that we continue to engage more and more students who grow up in this community to come to Temple and to be able to learn how to go back and serve the community. And so this Scholars Program is allowing us to do that. And then reputationally, it's important for us at Temple University, it's important for Independence Blue Cross to demonstrate best-in-class partnership where we come together, where we provide funding, wraparound services and support where we're able to articulate the kind of curriculum these students need so they can go back into the community. And so we have done that, and you just heard from these 4 young ladies who are about to study here at Temple University. They are going to represent Temple University well. They are going to represent Independence Blue Cross well in the future. And then these class of students, we will be right back here next year, and this class will continue to get bigger and bigger every year, but we will always remember our inaugural cohort. So congratulations again, ladies. So in closing, I would just like to say thank you all again for being here. We are proud to partner with Independence Blue Cross Foundation. We will continue to do this work. If you want to support us, if you want to support more initiatives like that, please reach out to us because we are doing everything we can to satisfy our mission of serving students in our communities and serving the community as well. So thank you very much. Okay.
Good morning, everybody. My name is Steve Farah. I have the privilege of serving as Executive Vice President at Independence Blue Cross. And I also have the privilege of working with an exceptional team. Reverend Dr. Lorena Marshall Blake, Heather Major, our Executive Director, Zaina Henry. These are the 3 professionals who are leading this effort on behalf of the IBC Foundation. And of course, it doesn't happen alone with so many of our IBC colleagues here today. But it all starts with Greg Devens, our President and CEO, who sets the measure, the North Star that we're following, not only to manifest our vision of equitable whole person health, but doing it with everybody. So Greg, I want to acknowledge your leadership in making this happen here today. And you don't need to hear Dr. Wingard speak for long to know that he's bringing a passion and an energy to Temple University. As a lifelong Philly resident, I'm so thrilled to have you represent a treasure in our region, our city, our nation. No pressure, but we're all expecting great things with your leadership, but we're here with you every step of the way. And that's emblematic. Independence and Temple have a history, a long history of working together to lead from the front. And that's what it's all about today. And speaking of leadership, we have a really great representation of our elected leaders. We have Senators Tartaglione and Sharif Street here. Representative Burgos, I see you here as well. And we have, Representative Bullock, good morning. I'm sorry, Representative Parker, I couldn't hear you. I had a sense of it was you, but didn't know what you were saying. So you could see the list grows, and then we have our council members, Councilmember Cindy Bass, Councilmember Catherine Gilmore Richardson, and Councilmember Maria Quinones Sanchez. I mean, it says a lot that they've taken the time out of a busy, crazy schedule to be here with us today. It speaks to their commitment to all the things that we're trying to represent by this partnership today. And it also speaks to your recognition of the role of nurses and what they play. And Lord knows, we don't need a pandemic to tell us that, but it sure reminded us of that nurses are the core to healthcare delivery. So thank you for your leadership in the legislature, thank you for your leadership in the community, and thank you for the affirmation that it gives us all today by you being here. And we look forward to working with you on so many more important initiatives to make our community a better and healthier place, but moreover, be the case study for how public-private partnership works and how we could change the narrative starting right here in Philadelphia. Thank you. And to the young ladies that both Greg and Dr. Wingard and Lorena mentioned, I just want to say 2 words to you too. No pressure. You and you are the Mount Rushmore what this program is going to be built upon. And it's so important because you are a start, not a finish. Today is just a small number that we get started to prove what can be done and to then accelerate the critical importance of cultural competency care, and it intersects with health equity. because if we're not all healthy together, nobody's healthy. If we don't have an equitable economy to drive us forward, we can't be healthy. So what you're doing is so critical, not only to inspire us to do more, but what you're doing is going to plant seeds for those that follow you, but you're also planting seeds of those you're caring for. And one day, when you reintroduce yourself to me, please be kind when you're taking care of me. And remember this moment. You've got a bright future, a positive trajectory. And Greg and I were talking earlier, it's the highlight of our day. So thank you, everybody. Thank you for having us be a part of this meaningful endeavor. It's a start, not a finish. We look forward to more partnerships like this. And now it's my pleasure to introduce Dr. Jennifer Brown, Assistant Professor of Nursing at Temple University, and she's leading this initiative. So Dr. Brown, thank you for your leadership, and we look forward to some comments from you. Please. Oh, I'm sorry. I'm looking over. Everybody's looking over there. I felt like it was the Academy Awards. Dr. Brown is not here to accept her award today, but thank you, Doctor. Please.
Thank you so much. And I noticed you were looking around, but that's quite fine. That is quite fine. Good morning, everyone. Good morning. It is my pleasure to join in this morning's celebration. Promoting positive outcomes for vulnerable populations, both in the communities and in the schools, is my passion. My decision to join the College of Public Health was heavily influenced by the mission to do precisely that. Shortly after joining the college, I was asked to lead this new initiative in the partnership with the IBC Foundation. The foundation has awarded various grants to Temple University in the past, and more than 50 undergraduate nursing students have participated in its signature nursing internship program, which has a 17-year history of helping to prepare the next generation of public health nurses. So, like many others have said before me, it's been a long relationship and will continue to even bear more fruit. Through this new IBC Foundation Healthcare Scholars Pipeline Program, we will change the trajectory of students' lives. We will be providing a 4-year academic scholarship for up to 20 students from underrepresented communities pursuing a Bachelor of Science in Nursing at Temple University. The program will also be supporting these students through their learning communities. They will be tutoring and provided tutoring, and will also be mentored throughout this program. For high school students in the local communities, the neighborhoods that our students are from, it will offer mentoring and experiential opportunities to expose those students to nursing as an impactful career, and also to help to prepare them to gain admission to Temple's nursing program. And Temple University Health System will be providing internship and employment opportunities for these students at the close of junior year and also upon graduation. We are excited to have welcomed our first 5 students, and one of our students is not here today, unfortunately. So you have been introduced to them earlier, and I will again say their names: Jamira Branch, Sahira De Los Santos Tapia, who's not here today, Justine Jones, Hannah Mailer, and Sakisha Similian. We're off to a great start. We have met with all these scholars and have begun individual assessments, and have also been providing academic support through tutoring. This is to ensure their success in the program, not just for the first year, but throughout. We want them to graduate as one cohort and to graduate together on time. This pipeline program will enable these students to focus their time and efforts on their studies. It will help to reduce their financial stresses, build secure futures, and reduce unemployment in their communities. Most of these students are the first in their families to attend college. Their success will be transformative. They will become ambassadors for the IBC program, for Temple University, for the College of Public Health, and for the nursing profession as they share their stories, and they have some amazing stories. I hope someday they will also become members and mentors to those other students or in the community, in organizations that promote equity, helping to ease the transition for students in high school to this program, and for students who are also, might not be interested in nursing, but to bring that interest. The program reinforces that Temple is committed to providing opportunities that will create social change. As a leader in healthcare and philanthropy, Independence Blue Cross Foundation knows that scholarships and meaning support can level the playing field for students of color. Your support promises to change the trajectory of their lives. Your support will also change the landscape of nursing and include diversity in the healthcare organization in Philadelphia and beyond. On behalf of the College of Public Health and the Department of Nursing, I thank the Independence Blue Cross Foundation for this generous and bold gift. We are committed to creating an environment where students feel included and can achieve success. I myself am a first-generation college student. I understand the power of this program to offer validation to bright and aspiring youth. We want our students to become catalysts to change the community that they're from. We want them to be empowered, to step out of their comfort zones. We want them to develop new and supportive relationships. And we also want them to have an appreciation for people of all cultures and backgrounds. Together, we are changing the face of healthcare. We are doing this and bringing more underrepresented communities in the front of nursing. Thank you. At this time, I'd like to introduce our student speaker, a proud student of Cristo Rey High School, a member of our first cohort of the Foundation Healthcare Scholars Pipeline Program. Let's have it for Justin Jones.
Hi, everybody. How y'all doing today? Okay, so my name is Justine Jones. I'm a graduate from Cristo Rey Philadelphia High School. I'm African American. I'm 18 years old. I'm also an older sister to a 15-year-old who's very annoying. But I'm also a loving friend. Currently, I'm a nursing student at Temple, and I'm going to be a trauma nurse after I graduate. Sorry. Okay. Out of all of my life experiences, I would have to say that going through life, I've met a few people who have changed me over time just based off of a conversation. And being as though I'm going into a career that requires me to talk to people and requires me to have a certain level of compassion for people, I am a strong believer in that one conversation can change somebody's whole life view. And through my experiences in high school, by being an ambassador, a soccer player, an AP student, even down to being a teacher, at my school, all of these roles contributed to my decision to become a nurse overall. And through these life-changing experiences in high school, it pushed me to be the person that I am today and to find the passion to push through hard times and to figure out ways to go around certain things. As an individual, and a young individual at that, it's rather hard to try to figure certain things by yourself. And with the help and guidance of Independence Blue Cross as well as Temple, I know that in 4 years I will be able to do what I need to do and to make everything that I need to happen. Nursing is an underappreciated career. However, it has so many lifelong benefits, professionally and personally. And I want to take advantage of these benefits by continuing my BSN education. So after I graduate with my BSN as a trauma nurse, I would go back for my MSN for research in African American and women's health. And then, thank you. And then furthermore, after that, I would go get my doctorate in nursing practice, also known as a DNP degree. so that I can become a professor and teach future nurses what I've learned in my experience over time. In my personal opinion, being a nurse doesn't just stop clinically. It doesn't just stop at face value talking to patients and getting them to understand their treatment care or anything like that. It goes further into helping other nurses or new nurses or people in 8th grade figure out that this is something that they want to be in. This is something that they want to help their community in. I wanted to become a trauma nurse so that I could give back to my community. And I really want to thank Independence Blue Cross for giving me this opportunity, because not only are you putting your money into me and putting your time into me, you're putting your money and time into the community, because I promise you that I will take this opportunity and I will use it to give back to my community. That is my main goal as a nurse. I also want to thank everybody for coming out today. I really appreciate everybody here to support all the high school students, freshman college students. We are trying our very best with our circumstances as individuals, as minority individuals, as minority females especially. We are young, we're inspired, and we have nothing more than complete control over ourselves when it comes to this field. We are all confident that we can do this, and I have full confidence, all of my other colleagues and peers, that we will make these next 4 years as nursing students the best 4 years that we can possibly make it, and we will make a statement for Temple and Independence Blue Cross, and I promise you we will make you proud.
Wow. I have an acronym for WOW, which is called Wonderful Opportunities Waiting. Justine, I can't wait to see what's going to happen. Again, let's give her a round of applause. Wow. I often say when I'm with nurses, is there a nurse in the house? The nurses are in the house today. Again, congratulations to all the IBC Foundation Healthcare Scholars. We are so proud of you right now. And I'm not going to sing. I'm so excited. I can't hide it today. Boy, back on script. You cannot wait to see what you accomplish here at Temple and in your nursing career. You have our full support, and we promise, just like you promised. And thanks to Greg, Dr. Wingert, Steve, and Dr. Brown for sharing their remarks today. Let's give them all a round of applause. I will leave you with one of my favorite quotes by one of my sheroes, Dr. Maya Angelou. And she says, in diversity, there is beauty and there is strength. So in this room, there is beauty and there is strength. So together, through this initiative, we are strengthening the healthcare workforce. And today is just the beginning. Thank you all, and have an awesome day on purpose. Thank you.